This year, RSNA showed us one thing. Radiology isn't just progressing, it's stepping into a new chapter where imaging is smarter, more insightful, and more connected to the rest of patient care. I want to walk you through what I saw in brisk and snowy Chicago this year and highlight a few companies that showcased where the field is heading. One of the biggest shifts this year was the move toward imaging that doesn't just show anatomy, but actually reveals how tissue is behaving. That came through in a big way with Seno Medical and their Imago breast imaging system, which combines ultrasound with optoacoustic imaging to show both structure and function inside a lesion. When a suspicious area has abnormal blood flow or oxygenation, the OA signal lights up in color, almost like a Christmas tree, and gives clinicians a window into physiology, not just appearance, and has the potential to reduce unnecessary biopsies and add confidence when the case isn't straightforward. They received an FDA PMA a couple of years ago and a CPT code in 2024, and now are scaling to make this the new standard of care. That same push toward adding biological insight to familiar exams showed up in a very different way with CureMetrix. Their CM angio technology reads breast arterial calcifications on routine mammograms. BAC has a strong relationship to future cardiovascular risk, which means a screening breast exam that women already get every year can now double as an early indicator of heart disease. There's no extra imaging, no added dose, and no disruption to workflow. It's a great example of how imaging is expanding from pure diagnosis into prevention. And then there's qure.ai, which is helping surface subtle but important findings earlier across chest x-rays and head CTs. Their AI tools work almost like a second set of eyes, flagging the studies that might need immediate attention. In high volume environments, that kind of triage support can make a real difference in how quickly patients get seen and how confidently clinicians can make decisions. It fits right into this direction the field is moving toward, where imaging doesn't just capture data, but helps interpret it in real time. That theme of smarter, more capable imaging carried over into the hardware on the floor as well. KA Imaging really stood out with their Reveal 35C detector that produces a standard top-of-the-line DR image plus clean bone and soft tissue images from one single exposure. There's no additional dose and no motion artifacts, which is a big win for both speed and clarity. What makes it even more interesting is how adaptable it is. You can retrofit it into existing equipment, take it mobile, or bring spectral imaging into places where normally it wouldn't be possible. And earlier this year, this same detector captured the first medical X-ray in space with SpaceX. If a device can perform in orbit, it's no problem handling the realities of a busy hospital or outpatient clinic. Ultrasound also made a strong push this year. United Imaging introduced their USonic family, built on a modern acquisition with automated measurement and guidance tools. The goal is to bring more consistency to ultrasound exams and help clinicians move through studies with more speed and confidence. And Samsung followed with the R20, which combines upgraded beamforming with AI-supported measurement and workflow features. It's designed for clarity and ease of use, especially in challenging cases, and puts less strain on the sonographer. Between both launches, it's clear ultrasound is leveling up in a meaningful way. While the clinic side of imaging is becoming more sophisticated, RSNA also highlighted how important it is to modernize what happens behind the scenes. And that's where AlphaNodus caught my attention. Their Gravity platform automates some of the most time-consuming and administrative tasks in radiology, like prior authorizations, insurance checks, scheduling, and document handling. These steps often slow things down more than the scan itself. And by removing that friction, Gravity helps imaging centers move patients through the system faster, while giving staff more breathing room. It's a reminder that the future of radiology depends just as much on efficient operations as it does on precise imaging. So when you look at everything together, the direction feels pretty clear. Imaging is becoming more insightful, more adaptable, and far more supported by intelligent systems. Companies like Seno, CureMetrix, qure.ai, KA Imaging, Samsung, United Imaging, AlphaNodus, and others are all playing roles in that shift, each from a different angle, but all pointing toward the same future. Thanks for spending a few minutes with me. for the 2025 edition of the RSNA Buzz Report. It was an exciting show, and I'm looking forward to seeing how these innovations make their way into everyday care over the next year. If this is where the field is heading, the future looks bright. I'm Danny Searing with Floodgate Medical, and I'll see you next time.